Good afternoon. I'm still chuckling about this Partners in Healing, Crime Healing thing, Angie. She always catches me off guard with something. Well, Director Dawson said all of the thank yous, and I just want to reiterate my appreciation not only to Director Dawson as our partner in healing, but to everyone that's been so involved in this reinvestment effort, particularly Senator Seitz and Representative Moran, and they're stepping up to the plate to demonstrate such significant leadership in getting this work done. And I always have to take off my hat to Justice Evelyn Stratton, sitting up in front, for the incredible work and leadership she has done prior to this work, through the years, into this work, and beyond this work, to assure that in the state of Ohio, people with behavioral health care issues are getting their needs met. Couldn't have done it without you, Justice Stratton, in terms of the work we're doing today, so thank you. In mental health, we strive to assure that there is an expectation for recovery for all people that struggle with mental illness and severe and persistent mental illness. It not only is a possibility to have recovery, it should be all of our expectation that the services and supports for recovery are available to people. However, I have great concern about our population who is co-involved with the criminal justice system. I think at times they're overlooked, they're viewed as different, and in some cases, when there's scarce resources, there's the pressure of who really gets to go to the front of the line to get service. When we have statutory requirement that so much of the dollars available flowing through the Department of Mental Health are available in our communities for adults and adolescents and children with severe mental illness, but we don't say much beyond that as far as prioritization of who within that population gets service. Often this population receives service, but in very uneven ways across the state, and sometimes not enough to make a difference. A lot of people don't realize that the Department of Mental Health all but runs a parallel system with regard to our efforts in working with people that are involved in criminal justice activity. And in fact, you're probably all aware that we run state hospitals, right? And we have 7 of those across the state at this point in time. Within that hospital system, however, we're spending $109 million a year for people that are there because they've passed through the criminal justice system, and they're with us because they have been found NGRI, not guilty by reason of insanity, or they're there for competency issues. Are they competent to stand trial? Are they restorable or non-restorable? And that $109 million is in contrast to about $86–87 million that are spent on all of the rest of the people per year that are in our hospital. The hospital costs for people that are in the forensic beds is about $605 a day. That's a high cost, and as we work with this population in the Department of Mental Health, we also have an effort that we are pushing out right now, and it is the Mental Health Forensic Strategies report that really contains information for how we reform our system as well, in order that some of those dollars are not spent at such a high price in our hospital system, but rather out in the communities. And I think as we do our work and our system and this work in a parallel fashion, we actually can learn from the work together about what may make most sense with regard to expenditures. In addition, ODMH funds many other efforts within this issue area. Across the state, we have 40 forensic monitors statewide who report to judges about people that are out in our communities on conditional release. We also fund 7 forensic psychiatric centers, and those centers are available to assist judges with regard to competency evaluations and evaluations around insanity pleas. In addition, those folks assist us in our hospitals when we would like to send people back to the community as far as doing risk assessments for us. We also fund 2, or I will actually say 3, coordinating centers of excellence. And we talk about evidence-based practices, and these coordinating centers of excellence make a huge difference for this population with regard to those evidence-based practices. One, of course, is the criminal justice CCOE in Akron, Ohio, that is so heavily engaged in assuring that law enforcement officers across the state are proficient with regard to crisis intervention activities as teams as they work with people with mental illness. And that CCOE also looks at the issue of mental health courts and other things. We have SAMI CCOE in the Cleveland, Ohio area, whose job it is to transfer knowledge to community providers about how to work with people with co-occurring disorders, drug and alcohol addiction, along with severe mental illness. And we know many of the people coming out of our jails and prisons need that type of intervention. In addition, that same group does supported employment. And through research efforts, it has been found that supported employment not only works with people as an evidence-based practice who have severe and persistent mental illness, but also with people who have drug alcohol addiction and who have been in the criminal justice system. So we have a lot of really great things happening across the state. However, we are burdened right now with regard to challenges around dollars available for community-based service. And at the same time, we are also burdened in our state with inconsistencies across our state with regard to unevenness in service, counties in which services are available, counties that are struggling to have any service available at the community level that can make a difference with this population, and extreme inconsistency with regard to data and data collection. We've been talking about this recently at ODMH, and it's almost embarrassing for me to say this, but I will. Through the years, my department has not had a mechanism to track the number of people served in our system across the state who are co-involved at any level with the criminal justice system. We need to add an affiliation code in order to do that. And that will require cooperation in a consistent fashion across the state from the provider system, the boards, but we need to do that, and we will do that. We also need to more consistently collect data when it comes to people who have had interaction with our CIT-trained officers and people who are passing through our mental health courts. Only if we collect data in a rational way that is the same across the state can we draw conclusions about what's working and with what population. As an example, many of you may realize that mental health has 7 people that work out of our system within the prison system across the state, and they handle the community linkage for people that are re-entering. And we know that when we get people linked to service, they are more likely to have a lower recidivism rate. And we believe we know now that the more service they get, which is logical, right, the lower that recidivism rate, and in fact significantly lower for people that have at least 100 hours of service per year. And that 100 hours equals probably about $10,000. But that's not much to pay when you think about the cost of keeping people incarcerated. But what we don't know is who are those people? How are they different from the people that receive less service? Is there something distinct about each of these populations? If we understood better, we could make a greater difference with the dollars we have. We are all challenged to assure that our dollars are used effectively and efficiently, especially in these times. So I think our challenge is to look at statutory change that would be helpful. And our challenge is also to gain consistency across the state of ours, which we all know is difficult to do, so that we can more effectively do what we actually know works. This morning we heard Senator Seitz really give a call to action. I believe he said, you lead, you follow, or you get out of the way. Well, Director Dawson and I aren't likely to get out of the way. And we don't particularly enjoy just following. I know there's a lot of other leaders out in this audience too, so I hope and I know that the fine work of this reinvestment process will link us together so that we really do continue to lead across this state and see significant change in areas that are most needed. Thank you.